Yeah.
Yeah, perfect.
PingHeng, it means balance in Chinese. I don't want to use balance acupuncture because I don't want to make any confusion. Maybe you have heard about this balance acupuncture from America, but the balance is just the core or essential idea in acupuncture. Every acupuncture system can call balance acupuncture. And I prefer to keep this Chinese name, PingHeng. It also called military because it is from the military medical service with acupuncture. Tonight, I will introduce the history first and explain some features of this military acupuncture or balance acupuncture or Chinese balance acupuncture. And I will also give 3 examples to show you how effective it is or how simple it is and how to understand those points. You're welcome to raise any questions during this presentation. PingHeng acupuncture was, collected or invented by Professor Wang Wenyuan, or Wenyue Wang. He started to learn acupuncture when he was only 16 years old. Maybe it's unbelievable now, but in that time, like 1960s or 1950s, it's totally possible to work as a therapist very early, since they still keep the family tradition than days. And a lot of masters actually start to learn acupuncture when they are maybe 5 years old or 10 years old. They're started to read the classics, and that's quite common in that days. He has had over 50 years experience in using acupuncture to treat soldiers. He worked as a military doctor, and in China we do use lots of acupuncture and herbal medicine in the military system. That's also why a similar condition in the United States, they use also acupuncture on the warship and for the victory affirmatives. All this system, these points are from his 50 years experience to treat over 100,000 soldiers and over 600,000 treatments, and also his training. He has a training center in Beijing that trains doctors from all over the country. That means over 100,000. And it is kind of a national promotion for doctors from countryside and community. That means remote areas. Maybe you know that China is a big country. There's still lots of people who lives outside the big city, so they don't have enough medical support, especially in the countryside, in the mountain area, remote areas. Yes, we need to use acupuncture because it's not so cheap, it's not so expensive. When there's a pain, when there's a fever, when there's something, they need to do something as cheap as possible and also has good effective. It is also some history related on the 1970s. In China, we have the doctor called Barefoot. Maybe you heard about Barefoot. That means they have only needles and herbs to treat people, especially in the countryside. And that's also the basic medical service still today. In the countryside, remote area or poor areas, they still use a lot of needles and herbal medicine to help people. It is one of the national promotion to train the doctors who work in the countryside or the communities. And it is part of the continuous education program, like here in Europe or many countries. Acupuncturists work as doctor in China. They have to keep studying. And the state administration has chosen some important or effective programs to keep the people studying, and this is one of them. And is one of the appropriate techniques to treat common diseases. That means like headache, like gynecologic problems, like stomachache, that common conditions. We need to use some like package or protocol to treat them. Based on this contribution, he was he also worked as a professor in Beijing University of Traditional Chinese Medicine, and he is the chief, of course, of the National Military PHA, that the PingHeng Acupuncture Training Center. That's some background of this. All this system are from hundreds of thousands of practice and training and treatment, and lots of national promotions. I learned this when I was an intern in hospital. I never heard about this when I was a student in the college. No, they won't teach this. But in the hospital, in the clinic, when I see the doctor using new points I never heard about, I saw, what's that? They just told me it's headache point, it is shoulder point. That's amazing for me to see that so simple points can treat so many conditions. I learned directly from the practice. And then I tried to learn more about this. Luckily I found the great students of Professor Wang, and I learned more about it. This system is so great because they are easy, they are safety, quick effect, and few needles. Let me see. Let me think. Or you could ask yourself, how many needles do you use every day? How many needles do you use every day? For example, when here comes a neck pain patient because of the computer work, how many points we use? Maybe one, maybe two, maybe three. Before I learned this, I could use maybe points on the neck, points on the arm. When there's like numbness for the fingers, maybe I will use 5. After I learned this, maybe 1 is enough. One's enough. That means few needles. Comparing to this traditional point system, we could use a lot of needles. Yeah, I'm not saying that they're banned to use a lot. I mean, for lots of conditions, few needles are enough. 1 needles, 2 needles, that are enough. But for this condition, like the multiple sclerosis or the lumbar disc or stroke, we do need lots of points. Here in this system too, for most of the pain conditions, we only use few needles, 1, maybe 2. That's why the doctors like it. We use this program to train Western medicine doctors. They don't have so many background of learning traditional Chinese medicine. They don't know maybe even yin or yang, but they want to use needle to help people. And they like this program because headache points, 1 point, a shoulder point, 1 point. They're very easy to learn and remember. And also quick effective. Quick effective because he treats soldiers. You could imagine that if you work on the battlefield, when there comes a headache, when here comes a patient with shoulder pain, it must be quick, like a painkiller, like morphine. So it's all from practice. I want to share you because there are few needles, quick effect, safety, and easy. Next, I'm going to introduce a little bit about the mechanism of acupuncture treatment in the system. It is also called balance, just because balance is the top principle for our treatment. We have yin and yang in the body, yang qi and yin qi. They must be balanced. That's easy to understand. And we have 5 elements. The fire and the water must be balanced, and the wood and the metal must be balanced. And also the middle, the spleen and the stomach must be balanced. That means everything must be balanced. When they are not balanced, that is called disease or a illness. So in our diagnosis in Chinese medicine, actually, we just need to find out where is the imbalance. For example, when patients come with low libido, fatigue, and a white or pale face and chill, they are totally yin problems. There are too much yin allergy, maybe cold, or dampness. Too much cold that means too much yin energy. It is not balanced. In treatment, we need to put yang, we need to give the body more yang, or to activate the yang energy of the body, then it is balanced. For example, we can use Do4 with moxa booster on Do4 that will strengthen the yin yang or the yang qi of the whole dumai. That is a treatment to give the body more yang, to activate yang, to balance it. Or we could use the herbal medicine, Fuzi, Acupuncturist, that will also strengthen the fire and the warmth of Shaoyin or the kidney and heart. Then the body has more yang qi. It is balanced in that way. That's the diagnosis, where is imbalance. And the treatment principle is to restore the balance. Acupuncture can do it, moxa boosting can do it, herbal medicine can do it, qigong can do it. All the treatment can restore the balance. Maybe that's a top principle in treatment too. On the contrary, when there are too much yang problems, like people have fasted pulse, fever, high fever, anxiety, and red face, red eyes, and so on, that means too much yang problems. We need to try to give the body more yin to balance it. For example, we can use large intestine 11. That is not to actually, it is not to give the body more yin energy. It is to reduce yang. That is also a treatment. We can remove, for example, there are 4 yang. We can remove, reduce one. That is large intestine 11 or large intestine 4. We can also use bleeding technique and do 14. Lots of treatment can reduce yang. Or like the herbal medicine of wubab also clear the heat. And the gua sha also reduce the yang. We can also generate yin, for example, like spleen 6, like then 4. Herbal medicine could be Dihuang, Romania. That will strengthen the yin. That's a balance method. In acupuncture, how can we do it actually? We do use acupuncture to treat lots of imbalanced problems. It also based on the principle that all acupuncture treatment must be applied to regulate Shen. Regulate means to restore the balance Shen. It is from the first acupuncture book, Lin Shu, Ben Shen, The Root of Shen, Private Spiriting. It's part of the Yale Emperor's Inner Classic. So here comes the keyword Shen here. What is Shen? What is Shen? Maybe you learn about Shen is kind of a top command of the body, which is stored or governed by the heart. That's correct. Actually, we have 2 kinds of Shen. The heart houses Shen, that is called Shi Shen, or consciousness. It's like consciousness, or this intelligence Shen, like our feeling. We can feel the pain. That is a feeling or sensation. That is Shi Shen. We have a lot of kind of Shen, which is called Yuan Shen, primary Shen, which is stored in the kidney or the brain. That is more like a subconscious. Like when people have PTSD, they have damage to the Yuan Shen or damage to kidney, And we have 5 kinds of Shen actually. We have Shen, Hun, Po, Yi, Zhi. The mind, the heart mind, the lung, the liver, ethereal soul, and the lung, corporeal soul, and intellect for the spleen and the kidney will. That 5 kinds of Shen actually control the whole body for our bodily functions. When there is Shen problems, actually, we could go deeper to find which kind of Shen problem is and to use acupuncture to do it. And the Shen can be similar, not the same. I'm not saying the same. We can use this nervous system to understand its function. It's not the same, they're just similar. Here comes another concept, Sanbao, in the body, 3 treasures. And Shen, the top commander, that will control or regulate Jing. Jing means the essence of blood. That means the most important substance of the body. Actually, it also means structures like the bone marrow, and so on. All these substantial things belong to the Jing. So the Shen regulate or dominate Jing and to affect their functions, that is Qi, the function, like spleen, stomach, regulate this digestion. Our liver control the emotion. Our heart control the blood vessels. That is Qi. So in that way, it's like our nervous system that to control the whole body. When you put a needle to the body here, anywhere, just example. We put a needle here, and the needle will send a signal to the spine and to the brain, That means response point, neural structure to affect the Shen through the nerve tract, nerve branch, nerve plexus. And as a feedback, this nerve system will control the blood vessel and also the immune system. This is a network called neuroendocrine network, or it will affect hormones, the hypothalamus, pituitary, adrenal axis. That's one of the most important axes for the hormones. So in that way, it's a network. The whole body connected. When you put needle there, the whole body can be balanced or regulated. I'm not going to the detail of this. If you have interest, you could find the article. Let's go back the Shen here and the Jing and the Qi here. When we put needle, actually, the needle will affect Qi first, right? We're seeing that the acupuncture will regulate Qi. In the first thing, we call De Qi when we put the acupuncture. When put De Qi. De means to have, to feel, to invigorate. That means feeling. People have to feel something. The needle here. And then it will go to the blood, go to the essence, and then it will go up to the Shen, Like we puncture large intestine 4. And finally, they will go up to the head and affect the Shen. We do also have other puncture system which can directly treat Shen. For example, Yin Tang. Yin Tang is the point that directly affects the Shen. So we have so many points on the body. We have points on the head, points on the arm, points on the trunk. All those points can be used to select, to regulate Shen. That is my understanding of the balance, how to recover the imbalance. And we do have lots of points to do that. And the Meister has selected 38 points, or after his 50 years experience, he found that these 38 points are the best to regulate the Shen of the whole body. That means to treat lots of conditions or imbalance. Before we go to the point, I will introduce more about the features. Mostly, they use single point, one needle to pain, especially acute pain. Like I mentioned, this acute neck pain, or lumbago, low back pain, knee pain, tennis elbow, or a golf elbow, whatever. That's especially for pain. One needle. And technique, quick insertion, manipulation, and withdrawal. That means put needle in, manipulation, De Qi, and then remove it. Very quick effect. Quick insertion, quick manipulation. The manipulation could be any technique. The most important thing is to activate the point to regulate the Shen. So basically speaking, they don't use such kind of reducing or supplementing. No, it's a more modern technique to have De Qi, and to regulate Shen. And if the pain or the problem is unilateral, For example, migraine on the left side, and then the point will be the right side of the body. That's a basic theory, actually, basic theory. It's also based on the nerve system. Or the shoulder pain, when there's only left side shoulder pain, they point on the right side of the body. That's a cross channel. And the last thing is quite practical, quite useful to treat pain. Moving affected areas while manipulating. For example, the left shoulder, frozen shoulder. After we put needle on the right leg, we should ask the body to move the arm, to move the painful place. That's why we don't put needle here. We don't use local points. We use distal points. It's better to move the painful place or affected place, then they can qi. The meridians can be collected, the nerve can be collected, the qi shen can be collected. Or when we treat neck pain, when there's a pain on the left side, we put points on the right side and then move the head. That's a basic principle. Moving the affected areas while manipulating. That's 4 features. And points distribution, there are only 38 points, not so many. Like the traditional system, we have 360. Actually, we don't use all of them every day. Maybe in my practice, I'll use about 40 points maximum. Yeah, we have to learn 360, but we don't use them at all. That's why this system is so popular. It's only about 40 points. That's much easier. And you could have all the points in 2 days or 3 days. And the points are half of the points are located on the arm and the leg. About 58%, 22 points on the arms. We have points on arms here, on the legs here, arms and legs, and so on. So we know the convenience or the advantages to use points on arm. It's easier to put needles, and it's quite safe. Safety is almost important. It's a big discussion here in Denmark about safety. I think it's always the most important thing. Even there are points on the chest and the back, they're all safe place. Like here, it's like then CV17. It's on the bone, it's quite safe. And on the back here, they're on the scapula, just behind the scapula. It's also quite safe there. And they also have points on the head. That's also quite safe. There's only one point that be very careful here on the top here. It's like gallbladder 21. It's similar to gallbladder 21. Don't puncture the lung. Then we be careful about the direction of puncture. Except that all the points are very safe. It's a good system because they're very useful in practice. All the points are categorized in 3 groups. First, it's called the body pain points. Body pain, like headache, like shoulder pain, elbow pain, knee pain, lumbago, and so on. That I call it external pain. That's pain. Yeah, we do have most of our patients for acupuncture who is coming for pain treatment. And another group is organ pain points, internal pain. For example, ladies, when the periods come, dysmenorrhea, or when there's some kind of heart attack, could be pectoris angina, could be stomachache, could be the pain of the abdomen because of the bladder infection, because of the intestines, colitis, and so on. I call it internal pain, organ pain. There are also lots of problem without pain, like insomnia, no pain, like poor appetite, no pain, like infertility, no pain, right? It's very useful to categorize their functions that way. External pain, internal pain, and lung pain points. Tonight, I'm going to show you 3 point for the pain, The first one, also my favorite one, I use a lot. This is called neck pain point. Neck pain point. That's quite simple. The point is called neck pain point. Once you remember the name, you know the function for all kinds of neck pain. It is located. I have a video later to show you how to find them, puncture them. I explain them first. It is located in depression of the fourth. You know, it's number 4, and it's number 5. The 4th and 5th metacarpal joints here, the knuckles here, the knuckles. You could try to find it after me. And here, it's in this area, It's in the depression, you can see that in the hollow depression between the 2 knuckles. It's about Sanjiao 2 and Sanjiao 3, in between the Sanjiao 2 and 3. Actually, it doesn't matter. We will puncture Sanjiao 2 and penetrate into Sanjiao 3. We're puncturing this way. So it's a penetrating technique in this area. Towards the wrist through the middle point. Yeah. Let's see the video. You could try to do it after me.
Neck pain point. It is located like.
Could you hear me? The video, the voice in the video, or no voice?
Just between this.
Is there any sound in the video?
Yes, it is.
Yeah.
Is that clear? Okay.
It's clear.
Okay.
Joint in depression, and we need to puncture towards the elbow. We puncture perpendicularly first, and then thrusting slowly. Oh, it's quite strong actually here.
It's very sensitive there. Slowly in third.
Slowly towards the elbow.
Towards the elbow.
Wrist. At the same time, we can ask the patient to move the head, or rotate.
This is quite important. When I manipulate here, we ask the people to move the head. When it was pain there, when there was kind of stiffness, when we do the manipulation, the people can, most of the, like 80% of conditions, they could feel the pain releasing. And if the people could feel dirty, goes up, that could be the best thing. While we're doing this manipulation, for example, rotating or thrust in and out, there could be dirty going up to the neck. Then the pain is gone or the stiffness is gone. I'm not saying 100% success, but 80% after my experience. You could also try that after this course if you have some people around you who has a neck pain, or use tomorrow in your own clinic. So manipulation, there's any technique you can use, rotating or lift in and thrust in to make dirty. And we could also tap. We could also tap the Sanjiao meridians to guide the chi goes up to the neck,
The head, or we can tap along this meridian to make the chi go upwards. The best condition that the people can feel dirty to the neck, it's like a collection of electricity radiating upwards to the neck, and the pain can be released. We can also scrap the needle like that.
Scrapping is also a good technique to make dirty.
To invigorate chi. We can do all the technique. We can do all technique 1 to activate point or to cause a dirty. Now I could feel it's kind of warming electricity directly go to the neck. That's a point. How deep should I puncture? It depends on how much dirty you could feel when the people is very sensitive, maybe could only 3 Chun. When the people not sensitive, could be 1/2 Chun. So it's very individual tips.
Right, the depth is individual. It could be very short, it could be very deep. Depends on how the reaction is. Normally, I will use a little bit long needle, like 40 millimeter, just in case the people couldn't feel it. If your clients most of your clients are sensitive, you can still just use 25 millimeter.
Right. After Deqi, we can just remove the needle.
Yeah, it could be kind of a. Yep. Remove the needle after Deqi. You don't have to keep the needle there. If you want, of course you can, but that's not the key point here. To leave the needle on in the body for 30 minutes, not necessary. Next is about the category or their functions. Category is a special parameter of a point. That means which part of the body can the point treat? Which part of the body? It is different from the meridian, the contribution. We know that this point located on the Sanjiao meridian. That's correct. In my system, it's just called which organ, which tissue, which structure can this point treat. It is spine can this point treat. Neck, for example, for neck pain, yeah, neck is part of the spine. That's an important part of it. So the question is, how could this point treat the spine? It's a Sanjiao points and treat the spine. You could think about it. Actually, it's very simple. Sanjiao meridians go to the point, do or GV14, right? Sanjiao meridian. All yang meridians go there. But another different or specialty of this point is that, or Sanjiao is that Sanjiao goes also to do one. That's quite special. And then it opens to bladder 39. Sanjiao has unique internal distribution, not only to do 14, but also to do one and connect to bladder 39. If you look at the location of bladder 39, actually, it is the same, almost the same as bladder 40. So in that way, the Sanjiao can directly affect the dumai or the spine, since it connects to do 14, do 1, and bladder channels. Bladder 40, we know that is one of the base for the lumbar, for the low back. Low back also part of the spine. So in my understanding of this also extraordinary point, we can always find a good explanation why it is so good. In the system, they used to treat first the soft tissue problems. Yeah, we do have lots of soft tissue, like computer work, driving 10 hours, for example, or the flying 10 hours, soft tissue problems, or like some training. And a stiff neck, maybe because of the wrong position of sleeping, and also some inflammations, tendinitis of the neck and shoulder. These are for the muscles, for the fascia, that's not so serious. And it could also be serious conditions like cervical spondylosis. Yeah, after people have this computer work for many hours or many years, they could have this nerve problems, like the finger numbness. That means cervical spondylosis, or even the disc prolapse. That's very serious condition. Maybe they need surgery. And we can always use this to control the symptoms or treat the pain. And other consequence due to the neck disorders or due to the cervical spondylosis. For example, headache, dizziness, eye problems, tinnitus. We could see that lots of those symptoms can be explained or can be combined, can be explained by Sanjiao meridian. Sanjiao meridian treat the tinnitus. Sanjiao meridian can reduce fire that can be used to treat the headache or dizziness or dumai, spine dumai. They are explained in that way, perfect. Or in the electronic, it's just some symptoms because of the cervical spondylosis. That's the first thing for the neck pain. And second indication is Sanjiao meridian problems like trigeminal neuralgia, sciatica, front shoulder, and so on. Just problems. And sciatica, that's quite. I just explained. It is related to blend 39 and 40. And leg. Again, blend 39. That's for the leg pain too. That's the explanation for the indications. Neck pain, that's the first thing. I hope you could remember at least one function of it. It is called neck pain point. So it treats leg pain, all kinds of neck pain. Next point is called low back pain point or lumbago. It's called Yao Tong in Chinese. It is located 1/2 turn superior to yin tang. Yeah, we know yin tang here. It's 1/2 turn. Yin tang here, 1/2 turn. It's about the center of the forehead, the center of forehead. It is also spine, but it's more for lumbar, Why for the lumbar? Dumai. And we know that in the meridian series, the distal part of the two ends of the meridian can treat each other. Points on the head treat the lumbar or sacrum, and of course, points on the sacrum or the lumbar can treat the head. It can treat lots of different lumbar pain, lumbago. Again, could be soft tissue problems or the fascia problems, or also pain of the disc flaps, and also, of course, sciatica. All kinds of Yao Tong. There is also a special way of puncturing this point. We need to locate where is the pain. Like I mentioned before, we need to choose cross-channel theory. When there is a pain on the right side, the right lumbar, the right low back, the needle towards left. Or when the pain is on the right side, the needle to the left. So it could be in that way, or could be that way. Maybe when people have a pain in the middle, it's in that way. That's also, yeah, it's not cross-channel, but it's on the opposite side, opposite direction. When there's a pain both sides, we can, of course, put two needles here, one towards the left and another one go to the right side. Here's a video. The point is located in between yin tang and the hair lines here. Yeah, it's 3 trend there. We have 3 trend on the middle point. The distance is 3 trend. If somebody has very high hairline, we can use the 3 trend. Yeah, it's 4 fingers here, 3 trend. 3 trend. The point is located in between, in the middle point of the yin line here. There are 3 directions. When people have the pain on the right side, we stick to the left. Or when people have pain on the left side, we stick to the right side. If the people have the pain in the center of the lumbar, we stick downward. Now I will show you how to just example to treat the pain on the right side. So I will stick to the left side. It's cross channel. Here. I would suggest that we massage a little bit here to avoid the pain. And pinch the muscle, pinch the skin here, and then puncture. Puncture the skin first, and then press the needle. Just go horizontally until she could have dirty. The dirty could be a filling on the whole left side in the forehead, or sometimes dirty could go to the like the temple area, or go to Taiyang, could be the whole head, At the same time, we ask the people to dance, to move the lumbar, to bend forward, backward, left or right. Remember this principle: move the body, move the painful place, and while manipulating. Right, that's this point. They're called the low back pain for different kinds of lumbago. 1.5 turn above yin tang. Actually, sometimes we also puncture the point towards yin tang or go to yin tang. Dirty is important. And it is on the dumai, that's why I treat the lumbar. The last point I want to share is called shoulder pain, like I'll say this frozen shoulder, 肩痛, shoulder pain point. It is on the lateral side of the calf, like goblet channel. 1/3 of the line collecting the capturing the fibula and the lateral malleus. So you could find here this fibula head, and this lateral malleus. It's 1/3 of it. 1/3 of it. It's on the goblet channel. You find the fibula head and this malleus tip, 1/3 of it. And perpendicularly 1 to 1.5 turn, it's a little bit deep, because normally there's deep thick muscle there, deeply. And of course, cross channel. When there's shoulder pain on the left side, which to the right neck, or vice versa. The category is for the liver problem. That's quite simple. Gallbladder, meridian, gallbladder, liver. They pair each other. And for the lung, I will explain later for that. And for the arm and legs extremities, shoulder belongs to the arm and leg. Let's say this indications first, and then I will explain why is that. For shoulder pain, why this can be shoulder pain? Meridians. It's gallbladder, sanjiao in their collection. And actually, we have similar points in their area, which can also treat the shoulder. That is stomach 38. That's also a special point in this area. Actually, we have different meisters find different experienced points or extraordinary points in this area, which can treat the shoulder. So in my practice, I would just search some tender point in that area to treat shoulder pain. There must be some special connection between the lateral side of the lower leg to the shoulder. We could say it's a meridian connection, gallbladder to sanjiao, or stomach to a large intestine, but there must be more connections to it. Again, it can be a soft tissue injury or frozen shoulder, or the shoulder pain because of the neck, after the neck pain. So when people have the neck pain and shoulder pain, we could combine them. We just had the shoulder pain, the neck pain point, that is sanjiao 2 and 3, again sanjiao, And then when there's a problem of shoulder, we can combine this. We can combine them. Besides the shoulder pain, it also treats the gallbladder channel problems or liver channel problems, like the migraine, headache, hypertension, or the anatomical gallbladder problems, like the parasites or like the inflammation of or the stones, gallbladder stones, and so on. In that time, maybe 50 years ago or 60 years ago, people also used that to treat the aceriasis, the parasites. But nowadays we don't have chance to do that. They must be go for operation. We don't do that. But when there's chronic inflammation there, or when there's some gallbladder stone, we could use that to control the pain. That's for sure. And the herpes zosters, there we know that's very painful. That is also typical gallbladder channel problems or liver channel problems. We can use that to reduce the fire, to treat it. I just had a patient, it works quite well to control the pain, with this point. And it also treats this Shen problems. Yeah, we mentioned that before. All points, not all points, most of the points can regulate Shen. Just some points are more effective than others. And this Shen disorder, that means normally it's called rebellious fire. The gallbladder is also called the minister fire. That means too much heat will rise up along the gallbladder, or the liver fire or liver wind will go up to disturb Shen, for example, hysterical syncope, or like stroke. This is also important point after stroke, for the stroke sequelae, or this also paralysis. It's also wind in chest medicine, wind. And schizophrenia, that's also rebellious fire. Maybe it's a combination of fire and flame. It's more complicated. And epilepsy and coma and so on, we can use that to drain the fire, And the other pain like a lumbar sprain, actually, it's also function gallbladder. The gallbladder and the liver are closely related to tendons or sinews. If we go a little bit up here, we could find the gallbladder 34, right? That's for all sinew problems. In that way, we could use this gallbladder points in the area to treat different kind of pain, especially the muscle sprain. And here, just a little bit deeper about its category. It can also treat lung problems. In the 5 elements, just go back a little bit to the balancing theory. So right. That's a wood point, gallbladder, typical wood system. When the rebellious wind, for example, or fire rise up, it will affect the function of the lung. Like people could have cough, people could have bleeding, people could have actually, or skin problems. All those problems, actually, they are symptoms of the lung system, but they are because of the liver or the gallbladder. So once we can drain the wood element, we could also treat the metal problems. So that's a unique thing in Chinese medicine. We need to find out what is the real reason for these symptoms. We can't see just all cough. We can use a lung point to treat all kinds of cough. No, it's not like that. Right, that's kind of a deeper explanation of that. For the last, all those points I blended the balance acupuncture point, PingHeng acupuncture point, and master tongue points, and traditional extraordinary points like yin tang or like lumbago points here. I put all the extraordinary points together and wrote a atlas to explain how to use them, how to understand them in our clinic practice. So if you're interested, you could find this book on Amazon. It's all about extraordinary points and the theory behind it. Right, my time is yeah, I think it's a good time. Now it's questions. All questions. Do we have questions in the chat? Oh no, just some kind of informations. Any questions? No?
So I think that was all pretty clear then to everybody. There is some information in the chat. Don't forget, this is part 1. This is the free part of a course that is a 3-part course. The second part is a 4-hour online, and the third part is live in Rotterdam. So Dr. Zhang